Okay, so acute versus chronic inflammation. This picture really says it all. If you have your hand on a hot burner, it's going to feel hot right away, and within milliseconds, you're going to remove your hand because of what you're feeling. I want to draw the analogy here to acute inflammation. Acute inflammation is a short-term process that occurs in response to tissue injury and usually appears within seconds or minutes. It's characterized by 5 cardinal signs. That's your pain, redness, immobility or loss of function, swelling, and heat. So think of the last time you injured yourself. This is typically what acute inflammation looks like. On the flip side, chronic inflammation is a slow process, and we sometimes don't even know that it's even happening. Inflammation is a good thing, and it's what's helped us survive as a species because it actually is the body's attempt at self-protection. The aim here is to remove harmful stimuli, including damaged cells or irritants or pathogens like bacteria, viruses, fungi, and parasites, and it helps the body to start to heal. All of this is managed through your immune system, which we're going to go into in a little bit. So today we're going to be focusing more on chronic inflammation. And as you can see, this is not just sore joints or physical pain. The prevalence of diseases associated with chronic inflammation is anticipated to increase persistently for the next 30 years in North America. In 2014, nearly 60% of Americans had at least one chronic condition, 42% had more than one, and 12% of adults had 5 or more chronic conditions. Worldwide, 3 out of 5 people die due to chronic inflammatory diseases like strokes, chronic respiratory disorders, heart disorders, cancer, obesity, and diabetes. And this is why I start with controlling inflammation in almost all of my cases, because it affects literally everything when it comes to your health. If we don't get it under control, we're not going to get anywhere quickly. So think of it kind of like throwing a garden hose on a house fire. You're technically doing the right thing, but if you don't get that fire under control from the inside, it's just going to keep burning and nothing changes. So chronic inflammation may mean different things to different people. Every system can be affected by inflammation, but it can manifest as different symptoms for everyone, which we're going to go into in a minute. Now, as I mentioned before, the inflammatory response is actually an immune response. So acute and chronic inflammation both involve the immune system, but just in different ways. I'm not going to go into all the details because we'll be here for hours, but inflammation is a reaction by your immune system to help your body heal from injury or to remove the thing that's causing the problem. Without inflammation, your health would simply fail because germs and viruses would overrun your healthy cells and nothing would ever get repaired. Inflammation starts when your body senses some sort of damage to your cells. Those cells release chemical messengers called cytokines, and these act as emergency signals, bringing nutrients, hormones, and immune cells to the site of the injury. To help facilitate this process, your arteries dilate and your capillaries become more permeable to allow these repair cells to access the injured area. From there, the immune system cells do their thing until the problem's fixed. Chronic inflammation occurs when the injury to the cells is ongoing or a predisposed immune system fails at self-regulation. And this is the case in autoimmune diseases where the immune system starts attacking the body's own cells by mistake. This can last from several months to years because the injury signal just keeps on happening and your immune system never gets a handle on it. The inflammation response keeps building and turns into these chronic symptoms and conditions. We also have cellular inflammation. So the cell membrane consists of a lipid bilayer, which includes cholesterols that sit between phospholipids, and this helps maintain a fluid membrane at various temperatures. When cells become inflamed, this membrane doesn't work properly, and nutrients and hormones can't get in, and toxins can't get out. This leads to cell dysfunction and eventually cell death and permanent injury to your organs, which then also leads to chronic disease. So symptoms or pain is your body's alarm system. This is your body's way of telling you that something's wrong, so we need to listen instead of ignoring these symptoms. Anyone experiencing these symptoms on a regular basis? This is by all means not an exhaustive list, but these are the common symptoms I see in my practice that are typically related to inflammation. So things like low energy and chronic fatigue, frequent headaches, allergies, digestive issues, high blood pressure, muscle and joint pain, weight gain, brain fog, mood swings, and mental health conditions. The list goes on and on. These are all signs of systems in your body struggling to work properly. So how do we measure inflammation in your body? There are a number of tests that we can use to measure and monitor the levels of inflammation in your body. So your CBC, or the complete blood count, is a group of tests that looks at the cells that circulate in your blood. This includes your red blood cells, your white blood cells, and your platelets. And the CBC can evaluate your overall health and detect a variety of diseases and conditions, things like infections, anemias, leukemias, and the white blood cell count in particular tends to increase in bodies with high inflammation. We also have the high sensitivity C-reactive protein, or the CRP. This is a protein that's made in the liver, and the levels in the blood increase when there's some kind of condition causing inflammation somewhere in the body. A CRP test measures the amount of CRP circulating in the blood to detect that inflammation due to the acute condition or to monitor the severity of disease in chronic conditions. This test doesn't tell us where the inflammation is coming from, but it lets us monitor how your levels shift over time to adjust the treatment plan. Oops. The sedimentation rate, or your ESR, is the rate at which red blood cells in a sample of blood are going to sink in a test tube over a period of about an hour. This is a common hematology test, and it's another non-specific measure of inflammation in the body to see how that inflammation is responding over time to treatment. We also have your homocysteine level. So homocysteine is a common amino acid that's in your blood, and it comes mostly from eating meats. High levels are linked to early development of a number of chronic diseases, including heart disease and stroke. And it's also associated with low levels of vitamin B6, B12, and folate, as well as kidney disease. Blood glucose and insulin. So research suggests that eating lots of sugar can lead to chronic inflammation. And other effects also include greater risk of diabetes, cardiovascular disease, and tooth decay. Uncontrolled blood sugar is a sign that your body is struggling to deal with the amount of sugar that you're eating. And this test is a snapshot of your blood sugar at any particular moment in time. Another measure of blood sugar is your hemoglobin A1C, or your HbA1c. This is a measure of how well controlled your blood sugar has been over a period of about 3 months, and it essentially gives us a good idea of how high or low on average your blood sugars have been. Finally, we've got your nuclear magnetic resonance spectroscopy, and this is a test that assesses your LDL particle size. So remember, LDL is your bad cholesterol, and small, dense LDL cholesterol is a distinct subclass of LDL, which is associated with high fat in the blood and decreased good cholesterol levels, specifically in patients with obesity and diabetes. So both play a really important role in atherosclerosis, which is the hardening of the arteries that we see in heart disease. So all of these are tests that we commonly use to measure how inflamed your body is at the cellular level, and we can monitor these numbers over time to see how the treatments we've recommended are changing things. So when we talk about inflammation, I want you to understand what's actually happening in your body on that cellular level. This is the arachidonic acid cascade, and it shows how fatty acids are converted into different metabolites through several different pathways. So the picture on the left is a cell, and on the right, we can see what's happening at the cell membrane when the inflammation cascade gets activated. So the phospholipase A2 enzyme at the top activates arachidonic acid at the level of the cell membrane. This activates cyclooxygenase, or COX-1 and COX-2 enzymes for short, and these produce prostaglandins. Now, prostaglandins are one of those cellular messengers, the cytokines that we mentioned before, and this is part of the natural response to stress. But excessive production can promote inflammation, pain, and fever. These COX enzymes are the ones that get shut down by anti-inflammatory medications like Advil and Celebrex, which is how they work in reducing the symptoms associated with inflammation. 5-lipoxygenase, or 5-LOX enzymes, which are on the right there, can also lead to inflammation and the production of different cytokines. These cascades are there to activate inflammation when it's needed. Remember, sometimes this is a good thing when we have to deal with cellular injuries, but sometimes it's too much and it lasts too long, and that's where chronic symptoms show up. So what can we do about it? There are a number of different medications that work by blocking the cellular processes that produce inflammation. However, they're also known for producing various side effects, including unwanted weight gain, blurred vision, stomach pain, fatigue, and sensitivity to light. So two that we've all heard of before, you've got your acetaminophen, or Tylenol. This is used for managing pain, but it is not an anti-inflammatory. So it truly masks the symptoms without actually affecting the cause. Then you've got your NSAIDs, which are your non-steroidal anti-inflammatory drugs. And this includes things like aspirin, ibuprofen, which is also Advil and Motrin, and naproxen, which is Aleve. These do decrease the inflammation, but they also affect other systems if they're taken too often or for too long. We also have your steroid drugs. So these are prescribed for intense inflammation, and they include drugs like prednisone and cortisone. They work by blocking that phospholipase A2 enzyme at the top of the cascade, and they stop everything from progressing down the line. We've also got our over-the-counter NSAIDs. So traditional NSAIDs are going to block both the COX-1 and COX-2 enzymes, but medications known as COX-2 inhibitors, which is things like Celebrex, were developed to work as well as the traditional NSAIDs, but with fewer stomach problems. So they preserve the COX-1 pathway function, so that protects the cells that line the stomach, and so it doesn't result in ulcers quite as much. And that's why they're prescribed as the drug of choice for chronic inflammatory conditions like arthritis. We also have leukotriene inhibitor drugs. So these are the first new class of medications for the treatment of persistent asthma that's been approved by the FDA in more than 2 decades. Leukotriene modifiers are medicines that are used to manage allergic rhinitis or allergies, and they also prevent asthma. So they work by blocking the action of leukotrienes, which are another type of cytokine, and they're typically not used for the first mode of treatment, but they can be helpful for people who are resistant to other more common treatments. So all of these drugs are modulating the inflammatory response in one way or another, but they all have what's called an analgesic ceiling. So this means that once inflammation grows large enough, the pain relief just isn't going to cut it anymore. And this is where people typically move on to the opioid drugs. So opioids are a separate class of very powerful drugs that are often prescribed to treat severe pain, and they're also associated with problematic use and fatal overdose. So opioids bind to and activate opioid receptors on the cells that are located in your brain, your spinal cord, and other organs in the body, and especially those receptors that are involved in feelings of pain and pleasure. So this can strongly reinforce the act of taking the drug, making the user want to repeat the experience and making them very, very addictive. Addiction has been shown to happen in as quickly as a week in some patients, even when they're taking opioids as prescribed by their physician. This class of drug also includes things like heroin, synthetic opioids such as fentanyl, and pain relievers available legally only by prescription, things like oxycodone, hydrocodone, codeine, morphine, and a few others. These drugs are only modulating the pain response, so they have no effect on the inflammation. They also have no ceiling dose. So this means that most people find that they need more and more to have the same effect when they're using them over time. So none of the drug options are perfect, which is why so many people are looking for alternatives to reducing their pain and inflammation naturally. The good news is that we can use food and plants to modulate inflammation as well. Different plant components act on different aspects of the inflammatory cascade. So depending on your symptoms and the underlying cause of those symptoms, we can pick and choose which ones are going to be most effective for you. Now, this is where it's very important to seek the advice of a professional because these components are usually found in supplement form, and there can be interactions with medications that we need to be mindful of depending on what else you're already taking. We also need to be aware of possible allergic reactions and adverse effects, and these can vary from person to person depending on your medical history. This is why I ask lots and lots of questions during your intake, some of which seem really random and way out in left field and really in no way related to your symptoms, but it helps me to pick the treatments that are the right fit for you as an individual. Remember that just because it's natural doesn't mean it's safe or harmless. So now we know what inflammation response looks like. We need to dive into what causes it. There are lots of different things that cause the cell damage that triggers the inflammatory cascade. We're exposed to many things in our environment, including allergens, toxins, stress, infection, trauma, low oxygen levels, drugs, and alcohol. And in our diet, we can have imbalances in our macronutrients, so the balance of carbs versus proteins versus fats, micronutrients, which is deficiency or excess in vitamins and minerals, accessory nutrients, which are other things that come from our diet, and phytonutrients, which are components that come from plants. So there are 7 main factors that cause inflammation that we're going to take a closer look at today: eating inflammatory foods, blood sugar imbalances, leaky gut syndrome, chronic stress, poor sleep quality, environmental toxins, and chronic infections. So number one is eating inflammatory foods. These foods tend to increase the amount of arachidonic acid in your system, which increases the speed of that inflammatory cascade we talked about. You are quite literally adding fuel to the fire the more you eat these foods. So the big ones are dairy, GMO corn, fried foods, wheat, refined sugar, and red meats. Inflammatory fats also have a huge impact on inflammation. So omega-6 fatty acids are found in vegetable oils, things like corn, sunflower, safflower, and peanut oils. And they're also in lots of processed and packaged foods. Omega-6 fat in and of itself is not the problem. It's also found in foods like nuts and seeds and eggs. It's generally important for health, but the problem is that we now eat far too much of it. And usually we eat it in oxidized form. So this means that the oils have been heated and are actually rancid. Repeated heating of vegetable oils is a common practice in the food industry, particularly in large deep fryers, because it significantly reduces the cost of food prep. Instead of having to refill a deep fryer with oil every single day, many manufacturers just add enough to top it off from the day before and only replace the entire batch every few days or weeks. Pretty gross. In deep fat frying, oil is also heated to temperatures greater than 400 degrees Fahrenheit, while also being exposed to moisture and air. This causes something called thermal lipid oxidation, which changes the structure of these fats into a more inflammatory form. Repeated oil heating also degrades the natural antioxidant vitamin E, which normally protects the fatty acids from this lipid oxidation. We also have trans fat, which truly is the bad guy. It is to blame for lots of disorders, including elevated blood triglycerides, obesity, and type 2 diabetes. Now, all fat is not bad. Saturated fat provides structure to our cell membranes and tissues. It strengthens our immune system. It helps in the production of hormones. It supports the nervous system, and it facilitates the absorption of several vitamins and minerals. When it comes to fat, balance is the key. Typically, a low omega-6 to omega-3 ratio is recommended, but unfortunately, this ratio can be hard to achieve, especially in North America, where our diets tend to be much higher in the omega-6s. This imbalance has been shown to suppress immune function, contributes to weight gain, and overall it increases inflammation. This is why omega-3 supplementation has become more popular as a way to reduce inflammation, because it helps us balance out that omega-3 to omega-6 ratio. Number 2 is blood sugar imbalances. The prevalence of diabetes in North America has skyrocketed in recent years for a variety of reasons. Among the US population overall, it was estimated that in 2018, 10.5% of the entire US population and 13% of US adults had diabetes. Insulin resistance syndrome includes a group of problems like obesity, high blood pressure, high cholesterol, and type 2 diabetes, and it's estimated to affect as many as 1 in 3 Americans. Now, these are American stats, but Canadians are not far off. So metabolic syndrome is a collection of risk factors that increase the chance of developing heart disease, stroke, and diabetes. Lifestyle plays a huge role in this process, so losing weight, increasing exercise, and making dietary changes can help prevent or reverse metabolic syndrome. You need to have 3 out of 5 of these for diagnosis, so it more holistically looks at issues in the body and how they're connected. According to a national health survey, more than 1 in 5 Americans qualify for diagnosis of metabolic syndrome. Now, blood sugar imbalance can lead to insulin resistance, which is one of the components of metabolic syndrome. Most things that blood sugar imbalances affect, things like fat in the blood, obesity, cholesterol levels, they all lead to high blood pressure and are therefore part of metabolic syndrome as well. Number 3 is leaky gut syndrome. This has become a huge buzzword and a hot topic in the world of functional medicine in the past few years, so we're going to break it down. The intestines are protected by a single layer of specialized cells, and these are linked together by tight junction proteins. Leaky gut symptoms are a consequence of the dysfunction in these tight junctions. So the tight junctions are the gateway between your intestines and your bloodstream, and they control what's allowed to pass into the bloodstream from your digestive system. Tight junctions have a very precise job. They have to maintain the delicate balance between allowing vital nutrients to enter your bloodstream while remaining small enough to prevent disease-causing compounds from your diet or lifestyle, otherwise known as xenobiotics, from passing out of your digestive system into the rest of your body. When you have a leaky gut, certain tiny particles that should never be able to enter your bloodstream start to make their way through, and this presents a major problem because the vast majority of your immune system is found inside your gut. This results in a disruption of acute inflammation and sometimes autoimmune reactions. The normal immune response that serves to fight infections and diseases winds up overperforming against these invading particles, leading to a chronic inflammatory response, which is at the root of most diseases. This is where food starts to affect your health. There is a big difference between food allergy and food sensitivity and food intolerance, so it's really important for us to distinguish between them. Food allergies, or your anaphylactic type responses, show up as hives, itching, swelling, redness, and they're mediated by histamine and the IgE portion of your immune system. Food sensitivities, on the other hand, are mediated by the IgA or IgG portions of your immune system, and these symptoms are typically more widespread and subtle. So things like fatigue, brain fog, body pain, chronic skin conditions, and digestive dysfunction. Food intolerances are foods that you can't physically break down. So things like lactose intolerance, where you physically don't possess the enzymes to break down the lactose molecule. It really has nothing to do with your immune system, but can still cause lots of inflammatory symptoms. At the end of the day, we want to avoid foods that irritate our gut, as all of these can cause inflammation and leaky gut syndrome, which then leads to inflammation throughout the rest of the body. Number 4 is chronic stress. So this is a diagram of Cellier's general adaptation syndrome, and it explains how our bodies adapt to stress over time. We are always aiming for a state of homeostasis where things are balanced and everything is working well. When any kind of stressor shows up, whether it be mental, emotional, or physical, we go into an alarm stage. This is our fight or flight response, which we've adapted over time to help us stay alive in the face of danger. Picture all the things that would need to happen to prepare our bodies if we were being chased by a lion. Our pupils dilate so we can see better. Our heart starts racing to prime our muscles with blood to be able to run away. Our breathing rate increases to bring in extra oxygen. Our nervous system becomes stimulated so we're prepared to run or fight. And our body temperature increases to speed up our metabolism. We've all felt these symptoms of stress before, but usually not in response to running away from a predator. This response is meant to be short-lived, but our stressors usually hang around a lot longer now than they did in the past. And this is where we start to enter the resistance stage. We aren't meant to sustain that stress response long term, so our bodies start to suffer as a result. And if that stressor continues long enough, we end up in a state of exhaustion or burnout. So in the short term, this stress response is adaptive, but over time, it becomes detrimental. When we look at the effects of chronic stress, we're really looking at how our hormones are affected. It would be nice if we could separate out our hormones and deal with them individually, but that's just not how it works. Your hormones are all interconnected in a big, tangled, messy web, and when one becomes disrupted, there's a chain reaction that affects all of them. I'm not going to go into all the details of this web, but your stress response mostly comes from the left side of this diagram with your hypothalamic pituitary axis, or your HPA, and cortisol gets produced in response to chronic stress. Cortisol can then go on to impact lots of other hormones, especially the thyroid, and it impacts how well we convert T4 to T3 specifically, which is your active form of thyroid hormone that your cells need to function. This is often a contributing cause when you have all the symptoms of low thyroid function, like being tired and cold and constipated. You've got difficulty losing weight, you're losing your hair, you've got hair, skin, nail issues, but all your labs are coming back normal and your doctor says everything's fine. Sound familiar? Cortisol can also mess with hormones like melatonin, which is important for sleep, insulin, which we talked about as being important for blood sugar management, and neurotransmitters, which are important for mood and energy. We can't always change the stressors in our lives, but we can help our bodies to respond better to them to get these cortisol levels under control. Number 5 is poor sleep habits. How many of us are guilty of this one? Phones in bed. We're going to cover this in more detail later, but sleep is critical to your overall health in so many ways. The immune function and sleep is a two-way street. When our bodies are inflamed at a cellular level, we get that chronic increased immune activation, which puts a massive burden on our system and causes fatigue and interrupted sleep. When we don't sleep well, our immune system doesn't function well, and we're more prone to infections and taking longer to recover from illness and injury. This becomes a cycle where our systems are constantly feeling run down and exhausted, and we're prone to even small disturbances in our functioning. Number 6 is environmental toxins, also known as our toxic load. These are just some examples of what we're bombarded with daily, from fluoride in our water to mercury in fish, exhaust fumes, BPA in water bottles, furniture off-gassing, beauty products that contain hormone disruptors and chemicals that need to be detoxed, and chemicals in our food, and many others. We're all exposed to thousands of chemicals every day, and it's virtually impossible to avoid everything unless you live in a bubble. But there are small changes you can make to decrease the toxic load your body is carrying around all day. And finally, number 7, chronic infections. So there's 2 different types of long-term infections. A chronic infection is a type of persistent infection that's eventually cleared. Latent or slow infections are low-level underlying infections that last your entire life. You're more prone to these types of infections if your immune system isn't functioning well, or if it's already overwhelmed by trying to keep everything else on the rails dealing with chronic inflammation. Examples of these infections are chronic sinus infections, candida infection or overgrowth, Lyme disease, and gut biofilms. So now that we know what inflammation is and where it comes from, it's time to learn what we can do about it. Strategy number 1, we need to take control of your sleep. We need to start looking at sleep like something you get to do as opposed to something you have to do. Yes, sleep may sound boring and like a waste of time when our days are already so busy and we're already strapped for time, but it's wildly important to our overall functioning and arguably one of the most important things you can focus on for improving your health. Arianna Huffington released a book not too long ago that dives into sleep and the massive impact it can make when we prioritize it. She talks candidly about her experience with burnout and the mindset of high performers prioritizing business at the expense of their health. The concepts in this book can easily be translated out of the business world into our own lives as parents, spouses, employees, and caregivers, and it breaks down strategies to prioritize sleep even when it seems impossible to do so. I highly recommend it for anyone who's looking to change their mind out about sleep. It's very, very good. So why is sleep such a big deal? Circadian rhythms are natural internal processes that regulate your sleep-wake cycle, and they repeat on each rotation of the earth roughly every 24 hours. It applies to pretty much every biological process in our bodies. Your circadian timing system is regulated by the suprachiasmatic nucleus, which is a small group of nerve cells found in your hypothalamus in your brain. The hypothalamus is considered to be the master gland of your body's hormonal system, and it controls hunger, thirst, energy, body temperature, and sleep cycles by acting as a master clock. When our body clock is on the fritz and we're not getting enough exposure to natural light, our serotonin production and our overall health suffer. This is part of the reason why we all get thrown off with the 1-hour time change in the spring and in the fall. Even just that hour throws our body's natural rhythm off, and it takes a few days to get everything back on track. We can use patterns in how you feel every day to find disruptions in your daily cycling and where they're coming from. For instance, do you crash in the afternoon and crave sugar, caffeine, or carbs? Do you wake up at the same time every night and have a hard time getting back to sleep? Show of hands for my 2 a.m. people. Do you find it easier to exercise at certain times of the day than others? Are you a night owl? Are you a morning person? All of these things are going to give clues into how your circadian rhythms are functioning. So if your sleep's a total disaster, this is where we need to start. We need 7 to 9 hours of sleep every single night. This doesn't mean sleeping less during the week and then trying to catch up on weekends. Our best sleep is always from 10 p.m. to 2 a.m., which means you need to be asleep by 10 p.m. Not getting ready for bed at 10 p.m., not turning off the TV at 10 p.m. If you're up past 10, you'll actually get a second wind, as the metabolic energy that would normally be spent for cell repair while you sleep will be used for awake energy, and you'll not only waste that metabolic repair energy, but you'll have a harder time getting to sleep when you finally do go to bed. No electronics. So blue light from screens, this includes your phones, computers, tablets, e-readers, the TV, they all block melatonin from being released from your brain. And so your brain stays stimulated and you have a harder time winding down at night. These devices should be turned off at least an hour before bedtime, and using blue light blocking glasses during the day can also be helpful in removing the disruptive signal from your brain. Bedtime routine is also super important. Our bodies thrive on routine, and having a consistent bedtime routine can help stimulate the release of melatonin and prep your brain and body for sleep. We also want to invest in a good bed and pillow. This is always money well spent. Your sleep positions matter as well. So back sleeping is good, but there's more of a chance of snoring and sleep apnea. So if you're overweight or you have breathing issues, this might not be a good fit for you. Side sleeping is generally best because your spine can stay neutral, and left side sleeping is also better for supporting digestion. Stomach sleeping is good for breathing, but it's tricky for spine alignment, so not great for people with chronic pain, headaches, or TMJ issues. Caffeine. Now, caffeine doesn't actually give you energy, contrary to popular belief. It just blocks receptors for adenosine, which is another neurotransmitter, and it's normally produced all day and makes you tired. If adenosine is allowed to bind in your system, you have enough to feel sleepy at nighttime. But if you drink coffee, the caffeine will block the adenosine receptors, so it can't do its job properly. Studies with caffeine show that you may be able to fall asleep, but you don't get into REM or deep stage sleep enough. It takes 5 to 8 hours for caffeine to clear your system, so it needs to be consumed at least 6 hours from bedtime, even if you don't feel the effects of it anymore. Alcohol is another one. It disrupts REM sleep, and it is also affected by adenosine levels. It changes the signaling pathways, so you feel sleepy, but your body's still busy cleaning everything up, so you don't get into those deep state of sleep. Alcohol is even worse for women because we metabolize it faster, which affects these pathways even more severely. You want your last alcoholic drink at least 3 hours before bed to prevent it from causing sleep issues. If we're taking it a step further, we need to get outside. Most of us are actually light deprived. Morning light signals your hypothalamus and all of its corresponding organs and glands to be alert and to wake up. Research suggests 2 to 10 minutes spent outside at sunrise and sunset can help program our circadian rhythms because the specific angles of light at these times can trigger your body to produce optimal levels of hormones and neurotransmitters, including serotonin and melatonin. You can measure these levels with Lux Meter apps on your phone to make sure you're getting the optimal level based on the seasonal change and where you're located geographically. Cooler temperatures also help to regulate your circadian rhythms and your sleep cycles. So ideally, your room should be around 68 degrees Fahrenheit, and you can also use a cooling pad on your mattress to keep your body on the cooler side. Our sleep cycles all night long in 90-minute increments, and we feel best when we're able to complete each cycle in its entirety. You can set your alarm this way so that you're more refreshed and you don't end up being woken up in a deep state of sleep. This is how most of your fitness tracker alarms work with your body, so you don't wake up mid-cycle, and there's some apps on your phone that will do this as well. Supplements and herbs such as chamomile, kava, valerian, 5-HTP, GABA, L-tryptophan, L-theanine. There's tons of them out there, but we need to be careful. So we need to be careful with melatonin supplementation. It can actually stop self-production of melatonin in your brain and create dependency. We also need to be careful with medication interactions. So many antidepressants, anti-anxiety medications, sleeping pills, and blood pressure pills can be affected by these natural products. So you absolutely need to consult a professional before you implement anything new. And finally, power naps are not a luxury. Research actually shows that after the age of 25, it can help us assimilate information better. The best time to nap is between 11 a.m. and 3 p.m. If you nap too late in the day, you're not going to be able to sleep at night. You want to have a pre-nap routine and try to nap at the same time of day, similar to a bedtime routine. And you also want to sleep for no longer than 20 to 30 minutes. This helps prevent the body from reaching the deeper stages of sleep, and it keeps you from waking up feeling groggy. Strategy number 2, we need to take control of your nervous system. So you have 2 parts of your nervous system, your parasympathetic or your rest and digest side, and your sympathetic or your fight and flight side. We're constantly flip-flopping between them, and both are important, but we need to keep them in balance. So the parasympathetic system governs everything related to relaxation and regular functioning when you aren't stressed out. So think about that lion example we talked about earlier. Your body is not in a state to be focusing on digesting a steak dinner if you're about to be dinner. The parasympathetic side stimulates saliva, digestive secretions, and stomach acids, and it promotes liver function, all to boost digestion. It also contracts the bladder to allow the kidneys to do their job properly and get rid of toxins, and it slows down the heart and lungs to prioritize everything else. For most of us, we spend way too much time in the sympathetic side of things, so we need to promote more of the parasympathetic rest and digest side. So if stress is a major factor in your life, we need to start simple. First, we need to find time to de-stress. Meditation and prayer have been used for literally thousands of years to improve well-being and connection to others, but today they're actually backed up by neuroscience as well. Natural stress relief meditation and mindfulness-based stress reduction are types of simple mental techniques that are practiced for as little as 10 to 15 minutes once or twice a day in order to bring about more mindfulness and reduce stress or anxiety. Various forms of meditation have been shown to lower physiological responses to stress, improve mental alertness, and help people overcome various emotional and physical problems, things like anxiety, depression, attention problems, substance use, disordered eating habits, sleep, pain, and weight gain. A few apps that I find very helpful for my patients are Insight Timer, which is still completely free as far as I know, Calm.com, and Headspace. If you're interested in learning more about meditation and how it may be helpful, I also recommend the book Stress Less, Accomplish More by Emily Fletcher. This is all about meditation for busy people who suck at meditation. Basic breath work. Did you know that most people don't breathe properly? First things first, we want to breathe through the nose as much as possible. It's your immune system's first line of defense, filtering the air and exposing it to immune cells in the nasal mucosa. The nose also warms and moisturizes the air and recaptures moisture on the exhale, resulting in 40% less water loss. The nose activates the diaphragm as well, automatically making the breath deep by pulling the air into the lower lobes of the lungs. The nose is your body's built-in regulator. It allows adequate oxygen in and prevents too much carbon dioxide from being exhaled. And this helps maintain the delicate balance of oxygen and carbon dioxide, which keeps the right acidity level in your blood. We also want to use the diaphragm when we breathe, which is much more commonly known as belly breathing. The diaphragm is the largest and most prominent breathing muscle in your body. It's the meeting point of the cardiovascular, digestive, and musculoskeletal and autonomic nervous systems, and it's designed to function along with the thoracic, abdominal, and pelvic cores. It acts as the primary stabilizer for functional movement. Now, more is not better when it comes to breathing. We want to aim for a 4 count on the breath in and a 6 count on the breath out. An average healthy person does 10 to 12 breaths and 4 to 6 liters of air per minute. So we want the same amount of air moving with fewer breaths in order to calm the nervous system. If you want to learn more about breath work and how it impacts your health, I recommend the book The Oxygen Advantage by Patrick McKeown. Very interesting read, and you'll look at breathing in a whole new way, I promise. And we also have earthing. So earthing is also known as grounding, and it's based on research that demonstrates how connecting to the Earth's electrical energy promotes physical well-being. The act of earthing refers to a physical connection between the electrical frequencies of the human body with the Earth's. So think walking barefoot in the grass or at the beach. The Earth has negative ions, and it helps to quench the free radicals in your body, and this can reduce inflammation and calm the nervous system. You basically just want to get outside whenever possible without shoes and walk around with your feet exposed to the ground. Pretty simple. When you're ready to take your nervous system to the next level, chiropractors and osteopaths can help to rebalance your nervous system and get to the root of nervous system dysfunction. I have some amazing practitioners in my network, so if you're interested, please let me know and I can definitely connect you. HRV biofeedback training is also very cool. So heart rate variability measures how consistent the time between your heartbeats is, and the more stressed out you are, the more inconsistent this timing is. You can actually train your heart rate by managing your stress levels and your breath work. Regular chiropractic care has also been shown to regulate heart rate variability, which can reduce wear and tear on your heart muscles and improve your overall functioning. The other thing we want to do is activate your vagus nerve. So not this kind of vagus. The vagus nerve originates in the brainstem and it regulates autonomic nervous system function. So these are all the bodily functions that we don't control. Things like breathing, blinking, digestion, heart rate. And the vagus nerve controls the parasympathetic function of the heart, lungs, and digestive tract. It also sends lots of feedback from the body to the brain. So that gut feeling that we've all had before, that comes from the vagus nerve. The end of the vagus nerve releases the neurotransmitter acetylcholine, which has an anti-inflammatory and calming effect on the body. So the more active this nerve is, the more time you're going to spend in that relaxing parasympathetic state, and the more your body can prioritize the rest and digest functions. There's a few things you can do to activate your vagus nerve. Number one, control your stress. You need to not be in that sympathetic dominant mode all the time in order to get into the parasympathetic state. We also need to focus on your gut. So there's a huge connection between your gut and your brain. The balance of bacteria in your gut affects the function of your brain and your immune system. About 95% of your serotonin, which is the neurotransmitter responsible for feelings of happiness and well-being, is produced in the gut and in response to healthy diet and proper gut microflora balance. The gut also contains about 400 times more melatonin than the brain if it's functioning well. And gut bacteria actually have their own circadian timing, and that can influence ours if the bacterial balance is out of whack. Cold exposure is very cool. This creates short-term activation of the sympathetic nervous system, but long-term activation of the vagus nerve. So things like contrast showers, ice baths, or even just getting outside in the winter can activate the system. Deep and slow breathing. So shallow, rapid chest breathing activates that sympathetic branch, while your deep belly breathing is going to activate the vagus nerve. Your vagus nerve travels down your neck, so the vibration from your throat from singing, humming, and chanting can also stimulate it. Activating the gag reflex is helpful for the same reflex, but much more pleasant. And gargling is also helpful for the same reason. You can add salt water for immune support or glutamine or probiotics for digestive health, depending on what your system needs. Daily exercise can also promote parasympathetic function, and acupuncture, specifically of the ear, can activate the auricular branch of the vagus nerve. And as we mentioned before, chiropractic or osteopathic care can be helpful as well. As you can see with this slide, the nervous system and the immune system are very closely connected, and we want both of them to be happy and functioning well if we're going to decrease inflammation. Strategy number 3, taking control of your gut health. So we know that the gut is a big deal, and it's ultimately the foundation of everything when it comes to our health. So we need it working as well as possible. Number 1, we need to be drinking plenty of water. So my biggest tip here is to watch your urine color. It should be pale yellow or clear if you're well hydrated, and it's a sign that you need to drink more if it's dark or very yellow. The exception here is if you are taking B vitamin supplements, because that will turn your urine highlighter yellow regardless of how hydrated you are. Get in the habit of checking the toilet and being mindful of the color, and having that be your signal to drink more water if necessary. We also want to eat a high fiber diet for proper bowel movements, and this includes foods like fruits and vegetables, nuts and seeds, whole grains, and generally less processed foods. And we also want to make sure that we're keeping a healthy microbiome by incorporating pre and probiotics. So this is lots of our fermented foods, things like kombucha, kimchi, sauerkraut, dark chocolate, and miso, or supplements can also be helpful for some people. We also need to remove high sensitivity foods. So the big 4 are gluten, dairy, soy, and corn. And I would argue processed sugar fits here as well. And we want to replace those with anti-inflammatory healing foods. So things like fruits and vegetables with lots of color, whole foods, things with less chemicals, and organic wherever possible. We also want to repair the gut lining with supplements when necessary. So one of my favorites here is glutamine powder. But again, be careful if you're taking other medications, because there can be unwanted interactions here. And we also want to rebalance the microbiome with high-dose probiotics whenever necessary. Strategy number 4, we need to take control of fitness and movement. So our bodies work on a use it or lose it mechanism. We need to train our muscles and our cardiovascular system regularly and push its limits at least a little bit to see improvement. Aiming for 10,000 steps a day is usually a pretty good start, but we also need to remember that fitness includes heart health, strength, flexibility, and core strength. So we need to think about functional movements. So these are things like squats, lunges, pushes and pulls, rows, and planks, and that's going to allow you to get the most out of your workout routine. We can also do things like sit-stand desks. That can be helpful for people who naturally sit a lot during the day at work. Another thing is we can leverage non-exercise activity thermogenesis, or NEAT for short. So NEAT is the energy expenditure of all of your physical activities other than voluntary exercise. So all of the incidental movements that are built into your average day aside from formal exercise programs. Things like changing your posture often. So setting an alarm on your phone to get up and stretch every 30 minutes. While you're sitting, you can sit on an exercise ball. This is going to activate the core and the pelvic floor muscles. Performing balance training. So if you're waiting in line for something, it can be as simple as lifting up one leg or shifting your weight from side to side. And you can also consciously fidget more often. One of the most effective ways to include exercise is high intensity interval training or HIIT training. These workouts are short and sweet. 20 minutes will do, and there's lots of YouTube videos available. So pick the ones you enjoy for the fitness level that you're at. I also have a fabulous trainer in my network who can work with anyone at any fitness level, and she's completely virtual. So if you're looking to increase your exercise capacity, let me know, and I can absolutely introduce you to her. Strategy number 5, hack your food and your supplementation. So number 1, we need to eat real food. Eliminating hydrogenated and partially hydrogenated and trans fatty acids, alcohol, simple sugars, and refined carbohydrates. This is really most things that come in a box or a bag and have a long shelf life. This can go a long way in cutting inflammation out of your body. We also want to increase those omega-3 fatty acids, particularly the EPA and DHA, and that's going to balance out that omega-6 to 3 ratio that we talked about. We can do this by incorporating foods like nuts and seeds, fatty fish, avocados, olive oil, and coconut oil. We also want to stabilize your sugar levels. So we want to optimize the insulin sensitivity in your body with a diet that's low in sugar, that has more good fats and moderate protein intake. So fats and proteins are going to slow your digestion and slow the release of blood sugar that comes with it. So it creates a less pronounced insulin spike to get the blood sugar back under control. Your cells also hear the insulin signal better when it isn't always sitting at a high level, so they tend to respond better. Insulin resistance is related to many chronic diseases, including diabetes, obesity, and heart disease, and it can be an underlying contributor to stubborn weight loss, so especially that fat that's held around the midsection. We also want to consider block or intermittent fasting for certain people. Time-restricted eating gives your body more time to focus on all the other things aside from digesting food. So it helps to improve cell turnover, which is linked to reduced risk of several types of cancers. It can help regulate the blood sugar. It can regulate blood pressure, cholesterol levels, triglyceride levels, and weight. So this is not a good option if your body is in that burnout phase we talked about. It does act as a physical stressor on your system. So if you think back to that Cellier's diagram we looked at earlier, if you're on the far right side of that, this is not going to be a good option for you. There's 2 apps that I do find helpful for fasting. One is called Fastic and one is called Zero. Both are free and they help you to track your fasting, to keep you on track and tell you what's happening in your body as you progress through your fasting interval, which is kind of cool. There's also a number of anti-inflammatory support supplements, things like omega-3s, turmeric, ginger, boswellia, bromelain. There's tons of options out there. Again, be very careful with these since many are going to interact with blood pressure, blood sugar, and many other medications. So I know that's a lot of information all at once. So I hope you found that helpful and not too overwhelming. If any of this resonated with you in terms of the health conditions that you're dealing with and you want to plan to put it all together, I've got you covered. I have developed a program designed to help you tackle the inflammation in your system from all angles in a realistic, sustainable, affordable way. It's paired with the Wellworld app, which is free to download and use, and comes with a 28-day meal plan, recipe guide, and shopping list. It also includes a 7-day body weight workout that's designed for any fitness level, practical breathing training that you can implement easily at home, and an educational ebook if you're interested in learning more about how your body is functioning. It's going to allow you to track your goals and progress in terms of nutrition, supplementation, mood, movement, and meditation, and it integrates with fitness devices like Fitbit, iOS, and Android trackers. Everything is simple and straightforward and totally virtual, and it takes the guesswork out of what you're supposed to be doing. Just follow along day by day, and by the end of the program, you should be seeing some significant changes to your health in terms of inflammation. Now, I think my favorite part of this program is the meal plan and recipe guide because food really is the foundation of health, and it's also the thing that people struggle with the most in my experience. Most healthy food is inconvenient or expensive, or you don't really know how to use it or store it or cook with it. This meal plan is accessible for everyone, and it really guides you in getting on track with your diet and kickstarts consistency over the 28 days so that you can carry those changes forward long term based on what works for you and what doesn't. So we've talked a lot about different foods that cause inflammation and how they affect your system, but it can be tough to navigate all the details to actually make these changes. The meal plan consolidates all of this information, so you just have to follow along in order to know that you're doing everything you can to avoid the things that could be contributing to your symptoms. So we're going to eliminate a lot of the foods that are causing the most inflammation, but keep in mind you may be able to reintroduce these after the 28 days, depending on how your body responds. Everyone's different in terms of their triggers, so some of these are going to cause more of an issue for you than others. So we're pulling alcohol, which includes all wine, beer, and spirits. We're also eliminating gluten and refined grains, which includes your white flours, white pastas, white breads, and gluten-containing grains such as wheat, barley, and rye. We also eliminate dairy. So this is cow, goat, and sheep milk, butter, cheese, yogurt, cottage cheese, cream cheese, all those guys. We pull all of your processed and packaged foods. If it comes with a food label, it's likely out. We also pull factory farmed and processed meats, including cold cuts, canned meat, hot dogs, and sausages. And these foods are typically high in refined carbohydrates and sugars in addition to added chemicals. For fats and oils, we eliminate the processed and refined oils, including canola and vegetable oils. We also pull soda, carbonated, and other sweetened beverages. And we also pull the inflammatory sweeteners, including processed sugars, corn syrup, stevia, agave, all of your artificial sweeteners, and processed fruit juices. If you've ever wanted to try eliminating the foods that you quote unquote shouldn't be eating and really reset your system, this is the simplest way to do just that. But what's left, you ask? Lots. There's many, many delicious foods to consume, and all of these recipes are incorporating foods that reduce inflammation and support your health overall. All of the whole fruits are included, but we limit them to 2 to 3 servings daily to keep your blood sugar in check. All vegetables are included, but we try to focus on the ones with the most color to boost your intake of vitamins and minerals. We're focusing on gluten-free grains as much as possible. So if you've ever thought about experimenting with gluten elimination, this is a great time to do that. We are focusing on good quality meats wherever possible and limiting red meat, as it tends to increase the arachidonic acid that starts off that inflammatory cascade we talked about. We're focusing on the low mercury fish and seafood, which tend to be higher in those omega-3 fatty acids and lower in toxins. Beans and legumes are going to include all of your beans, peas, lentils, chickpeas, and we're focusing on dairy-free substitutes as much as possible. This is including your plain and unsweetened almond and coconut milks, yogurts and cheeses, cashew milk, rice milk, oat milk, and for these, you want to choose the ones that require refrigeration, since they don't have the preservatives that the shelf-stable ones contain, and this is another easy way to reduce our toxic load. Eggs are included, as well as healthy fats such as avocado, nuts and seeds, and cold-pressed extra virgin oils. Caffeine is included in moderation, and I want you to notice how it affects you. Some people are more affected than others, so if it throws you off, it might be worth eliminating to see what kind of effect that has. We include vinegars and condiments like apple cider, white wine, red wine, and balsamic vinegars. Fresh green juices that are cold pressed are also included. Dark chocolate is totally okay, and we want it to be raw with at least 70% cacao content. And we're also focusing on natural sweeteners. So honey and maple syrup are used sparingly, and you want to make sure that these are the raw and unprocessed versions. So this is the kind that crystallizes if it's left out for a while. And if that happens, you just need to heat it up a bit to melt it. It doesn't mean it's gone bad. Finally, all your herbs and spices are included, and they're encouraged to keep your food satisfying and for added anti-inflammatory effects. So this meal plan takes all the guesswork out of eating in an anti-inflammatory way, and it makes sure you're avoiding the foods that cause inflammation while incorporating the foods that benefit your health overall. The app allows you to track several different aspects of your health, including your diet and nutrition, exercise, meditation practices, sleep habits, and overall well-being, so you can keep yourself accountable and on track and really see what changes over the 28 days. You're then more able to prioritize the things that made a big difference for you going forward and see what comes easy versus what takes a bit more effort for you and where you struggle. All of the information is in the palm of your hand, so it's always available to you, whether you're at the grocery store, at work, or at home. And the more consistent you are for the 28 days, the more likely you'll be able to carry these habits forward long term, which is really what we're aiming for. All of your workouts are easy to find, so you don't need any equipment or to find the right YouTube channel to follow the program. The exercises are designed for all fitness levels, and you can make them as difficult or as easy as you need to. And the guided meditations and breathing exercises can be done from your desk, your bed, or in your living room because they're all available right from your device. I've really tried to take the guesswork out of making big lifestyle changes so you don't feel overwhelmed and you're set up for success as much as possible. If you can commit to yourself for 28 days, the rest of the work is done for you. You just have to follow the steps. It's always so much easier to be proactive about your health, and treating problems when they're small and tackling them before they become giant is always best. Reducing inflammation is the first step in optimizing your health now and for many years to come. If you're looking for a simple way to get your health on track and start tackling inflammation from the inside out, the link for the Anti-Inflammatory Kickstart program is here for you. It's at a cost of $97 Canadian, and all the information you need is available at this link. So feel free to check it out and let me know if you have any questions. I genuinely want to thank every one of you for taking the time out of your busy lives to attend this webinar. And I very much hope that you found it helpful and that you learned some strategies that you can implement right away to start changing your health for the better. Many of you have my email address already, but if not, it's right there for you. If anyone has any questions, please don't hesitate to shoot me an email. I'm happy to follow up with you in the next few days. And we have a few minutes now. So if anyone has questions, I'm happy to stick around and answer them. Just throw them in the chat and I will take them in order. What was the meditation you booked? So the meditation book is Stress Less, Accomplish More by Emily Fletcher. And it's available pretty much anywhere you get books. Anybody else have any other questions? Alrighty, it doesn't look like it. So this concludes tonight's webinar. As I said, if you've got any questions that you think of later, by all means, send me an email. But I hope everyone has a great rest of their night and enjoy your weekend.